Hi, this is Alicia Goyer, and today I'm going to talk about advanced directives and living wills and do not resuscitate orders. And this is for ethical debate for our nursing class current trends and issues. First off, let's start off with what is an advanced directive. An advanced directive is a statement written by the patient concerning wishes and treatment preferences. Advanced planning allows for patients to consider future healthcare decisions when they are still relatively healthy and able to make those decisions. It is a legal document that needs to be signed and notarized. Most people go to a lawyer to have these drawn up. Although at my hospital, our chaplains take care of that, and we have advanced directive booklets that we give to patients if they request them, and they're able to fill them out. It's pretty broad statements about what they want done as far as being intubated or having a feeding tube. And then it's also witnessed by, I think, 3 people on our advanced directive booklet that we have, and then it becomes a legal document and it's on file at the hospital. Studies have shown that simply communicating about advanced directives and living wills with patients will increase their chance of actually completing one. And I know at our hospital we're required to ask every patient that comes in if they have one, and I assume that that's the same at most every other hospital. The pros for having an advanced directive or a living will are that it lets family and healthcare providers know what your individual wishes are. If you should be incapacitated and you're so ill that there's no hope of you ever coming off of the ventilator, that kind of thing. And it makes decision making easier on your family should the need arise. It also can prevent a complicated stay in the ICU from happening potentially, and prevents invasive procedures such as intubation when there's really no hope that you would ever come off of the ventilator should you have to be intubated. And a do not resuscitate order in most cases will prevent CPR from being done on a person in a futile attempt to bring somebody back, and that will result in unnecessary intubation, placement on the ventilator, and of course broken ribs from CPR, and also burns on the patient from shocking. One thing about a do not resuscitate order that I want to mention, that a do not resuscitate order is not legally in effect if you are coming in to have a procedure done. If you're coming in to have a colonoscopy or an EGD or an arteriogram or a biopsy and CAT scan, anything like that, and you do have an advanced directive that has a DNR with it, we are required to have you sign on the bottom of our consent forms that says that we told you that should you stop breathing or something happen during the procedure, that we will bring you back, because most of the time it's due to medications, and we can give Narcan and Romazicon and reverse that. So patients are aware when they come in for a procedure that if something is to happen, that they will be resuscitated at that time. Some cons for advanced directives and living wills would be just the fact that a lot of people think that they're very complicated when they really aren't. And that does prevent a lot of people from wanting to have one or pursuing getting knowledge about getting one. And they also have little influence on decisions to treat, as in a complicated ICU admission. In 2014, a study was done in Kentucky, and they found that patients that were dying in the ICU setting did not receive care that was consistent to really what their advanced directive had said, just because the lines were blurred. It suggests that interpretation of an advanced directive may not take place in the context of complex disease processes that go on in the ICU. Another con would also be that all family members may not agree to what actually is on the advanced directive, and this can lead to ethical questions and ethical issues when it comes to somebody who is in the process of needing for the healthcare providers to determine what goes on based on the advance directive. And also needs change over the years, especially with people with chronic illnesses like HIV. People live longer, and if your advance directive is several years old, it may not reflect what you want at this time. And it should be updated periodically as needs change with your chronic illness. And also laws vary in different states. I don't know if everybody knows, but in the state of Oklahoma, if you do not have it specifically stated to your healthcare proxy or to your family physician that you do not want a feeding tube, you will not die in the state of Oklahoma due to lack of nutrition or hydration. You will get a feeding tube. And a lot of people are really unaware of this law that does exist in the state of Oklahoma, and so it's very important to address all issues when it comes to filling out your advance directive and communicating what you want to your family members. And I hope this was enlightening to some people, and everybody have a good day. Thank you.